Yeah.
All right, and so we're on Dr. Connie Wang with Just a Pinch podcast. Thanks for coming on tonight. This
Thanks
is
for
awesome.
having me on. Yeah, I appreciate it. Both of us probably had busy work days, so I just so appreciate your time.
Oh no, likewise, likewise. What's this microphone you got there? That's a different one from what I've seen.
Yeah, okay, so this is a Rode. I actually got it off of Amazon. Everything I get is off of Amazon for the podcast that I have. This used to be like a little travel size, like this what you're seeing, and then I got this like super cheap like table mount for it. Like no name, I don't know what the brand is, but like it looks really legit, but it's actually a travel size mic and it works, I think.
No way. Well, that's funny because I get everything on Amazon, like literally everything on
Yeah.
Amazon too.
Uh-huh.
so,
Yeah, it's the only
so
thing I
that's
use.
and we both just said we both use Riverside for the podcasting platform. That's awesome. That's awesome.
Mhm.
So wait, wait, let's just real quick because we were chatting a little bit beforehand, but let's just
Yeah.
wind back real quick. What was it? What was it? September? October? When we bumped into each
Uh,
other, Blue Point Brewery. This is out on Long Island in the Blue Point
yes.
area. That's like Sayville, Patchogue, South Shore, about halfway out on Long Island.
Like
And we
random.
were
Like I was not expecting to see anyone.
That's so funny. And so you were visiting some friends you said from pharmacy school?
Yeah, so like a lot of most of my like best friends from pharmacy school, for some reason I went to a pharmacy school where like everyone was from like Long Island, New Jersey. So I was visiting some friends there, and lo and behold, someone taps me on my shoulder, and guess who it is?
That's so funny. Which pharmacy school was it too? Just for listeners don't know everything.
Yeah. So I went to University of Rhode Island. I grew up in Rhode Island. Like I'm like a Rhode Islander, like pretty much all my life, like all that I can remember. And so that's the school that I went to before. But yeah, for anyone that's like just joining in, so I ran into Brendan at this like random brewery. He comes up and says hi. I'm like so starstruck, and like I was telling him I leave the house maybe like twice a year, so he caught me on like the one time I left.
That's so funny. No starstruck. I was starstruck. That was so funny because I was like, wait, you did just how long have you been doing the podcast now, by the way? It's been a while.
Yes, it's been we're about to hit this February. We're about to hit 2 years now. Mm-hmm.
I was gonna say, and I've been so pumped with you. First of all, I've been listening to your podcast. You are
Really?
mentors.
No
Yeah.
way! Stop. Thank you.
Your voice, your attitude, your personality, and how you kind of bring out, like, I've been thinking about that for a while now. I've been thinking about how the patient said this, the patient said that. One of my favorite
Hmm.
podcasts that you did was on like kind of eliminating distractions and focusing only on what you can control. This is
Yeah.
back in October, November, December ish, but
Hmm.
like outstanding, outstanding.
Oh, thank you. I can't believe you remember that because, like, honestly, I feel like such imposter syndrome half the time recording it because, like, some backstory for anyone that's like new here. I just started working as a new grad, like, as of May, right? Well, like July. So a lot of my episodes are really just like me putting together, like, realizing things as I'm driving home, being like, oh man, I should have handled that better, or like, oh, like, so I'm kind of learning live with you. So that's like the craziest thing to hear. And it's so humbling to hear someone that I like look up to, like you saying that, because it's really just me like trying to piece things together and figure it out.
That's what makes it so great. And you know what? It's about the journey. We're
Mm.
about figuring it out together. I'm in the same thing too. I'm still in residency, I'm still training.
I know.
And
Wait, how many years do you have left?
just less than a year and a half now. So I'm not
Does it feel
graduating.
like it? That's wild.
It's a ways to go, unfortunately, but I guess small steps, right?
Yeah. I mean, like you handle it with grace though, because I feel like for your program, it's not like for the weak of faint of heart. Like, and it's a long program, right? Like, how long was it total?
There were 4 or 6 years. I'm just doing the 4 year one. Yeah.
Okay. Got it. Well, but I mean, to some extent though, do you feel like your like co-residents, not to like flip the script totally,
Sure,
but I
yeah,
can't help
yeah.
myself. I'm curious, do you feel like, because how many co-residents do you have?
16 altogether, so 15 co-residents.
15 co-residents. Do you get to spend time with them, or is it like you're all on your own kind of?
To be completely honest, we need more residents.
Really?
We don't have any non-cads. That's like the 1 year intern. They come in for a year and leave. We have none of them. We
Got
could
it.
use them, and so to answer your question, we're so spread thin that I see other residents periodically. Right now, I'm on an off-service rotation in the emergency department.
Nice.
I'm not seeing anyone. I haven't seen anyone. Well, I did for a dinner we had last week. We'll have like a dinner 2 or 3 times a year. But,
Hmm.
but yeah, we're spread thin. I don't see co-residents as much as I like to. We cover 3 hospitals, the dental school, and Yeah,
That's
yeah,
well, because
yeah.
what I was thinking was like, you go from being in dental school, which feels like a very social environment. You're kind of like all on top of each other. It's stressful, and then to now, there's probably times where you feel like isolated or like you're taking on a lot. And so I feel like that's got to be such a contrast going from like constantly doing everything with friends in dental school to like figuring it out.
Actually, that's a really good point, and that's a good question to ask some of my co-residents and see how they're taking it. I take it
Yeah.
like it's like, Connie, let's hop on the podcast, let's talk. And then
Yeah,
like
yeah.
boom, we're on. So that's kind of how I escape the kind of loneliness, if you
Mm,
will. Like I got a little tiny studio apartment, but I
mhm,
hop on. You're doing social media, you get it. It's a great
mhm.
if you don't get too caught up in the dividing of social media, distraction. It's a great way to connect, network, and
Yeah.
kind of socialize, literally.
Well, I have a question too. I don't know if you feel this way because we've been doing it for like a similar amount of time. Don't you feel like sometimes the most supportive people, not that we don't have supportive people in our life, but sometimes I feel like the most supportive people are like the random strangers, the people I've never met, or like the people that have been following for a long time though. Like they're the ones that are always commenting on my stuff, like not my real life people.
100%, 100%. I couldn't agree more.
Yeah, it's weird.
Isn't it weird where it's like the circles? It's like people that are in the
Mhm.
middle circle are like they're friends, but they're far away. You met later in life.
Yes.
The close circle is like they're so busy in investment banking or doing this and that, and then it's
Totally.
kind of you're right. It's such a weird like the circle levels is pretty cool.
Mhm.
So okay, so now let's rewind. The
Yeah.
last dozen or so of your podcast, there's been a lot of like maybe even more, maybe less 20. A lot of them were kind of like career revamps, career readjustments. And you were a pharmacist. You went to pharmacy school, Rhode Island, Tufts Dental School. Can I want to get just a snapshot of what was going on in your mind? Just what provoked that thought? What made you take action on it too?
Yeah, totally. So, which
Wait,
is
wait,
like
why? Why'd
criminal.
you have to decide?
So it was never a question for me. It was like the most affordable route. And when I was 18, I didn't fully know what I wanted to do. I just like knew I wanted to do something in healthcare. And so our program in our state university of Rhode Island, it's like the best pharmacy program around, high. It was very well known. And so I was like, okay, I guess I'll just like do it. And if I don't like pharmacy, then like I can always drop out before I start the pharmacy program. The problem was I loved college. Like college was fun, right? And so I kind of mistook that as loving pharmacy. I was like, I'm having a blast with my friends. Like I don't want to transfer out. And I was kind of afraid to like go against the grain at that point because like all my friends were pharmacy majors. I developed this identity of being like Little Miss Pharmacy. I was like president of like the pharmacy sorority. I don't know if you've ever felt this way. Have you ever like felt caught up in like an identity, even if it wasn't fully what was right for you, but you felt caught up in like identifying with it?
Yeah. Oh yeah, for sure. College basketball, I felt the same exact way. They love the clickiness. I don't like
Yes.
clicks. I'm not a click person.
Yep, yep.
I don't know about you.
Yeah, so basically, I just felt kind of like, oh, I've committed this far into like my identity. I don't want to switch it up. But then what happened was, then I started real pharmacy school, and real pharmacy school was not like undergrad. It wasn't fun. It wasn't like having a blast, like going out all the time. It wasn't like making friends. It was like hard, and I felt myself like learning in lectures and sitting there. And when we would get to the part about like the body and stuff, I'd be like, cool. But then when we get to the part about the drugs, the dosing, the real pharmacist stuff, I was like, someone else can do that. And then one day I was studying for like a cardio exam. I was like alone in the library at like 1 a.m. And I don't know what overcame me, but I was like, I think I'm studying to be the person that has to deal with this. And I was like, huh, that's a problem. That's a problem there. Um, and a little fun fact, I don't share this often. I'm curious actually, Brendan, have you ever been fired from something?
Like a job?
Yeah, like a job, let go, something like that. It's okay if
Um,
you haven't.
Senior year of high school, the guy didn't want me on the basketball team. Other than that, no
Oh,
firing.
yeah. Okay. Well, I'm sure that must have hurt, right? Like
Yeah,
when it
no,
didn't happen.
similar aspect. Yeah.
Yeah, so what happened was another thing I formed my identity around was being like my summer job. It was like a summer orientation leader. I was like really into, like I said, like my whole identity was being this like kind of school spirit person. And all my best friends got rehired, and I didn't get rehired for it. So that was like soul crushing for like a number of reasons. But the biggest thing it gave me though was that summer I was free for the first time. I was like at home kind of moping, being like, man, pharmacy school sucks. All my friends are doing the job that I want to do while I'm at home. And it sucked, of course, but what it gave me was the clarity. And that was the first time in my like adult life where I realized like I don't think I'm like choosing a path for me. I'm just going down the path that was given to me. But I didn't choose this life. I didn't choose to
Mm.
be a pharmacy major. I feel like a loser for like not putting my best foot forward, not being hard. I just felt like I wasn't showing up for myself. And so I wasn't that day like I'm gonna become a dentist. But I started thinking, okay, what would me, my best self, show up as? And I started to slowly put together the pieces. Like, okay, me, my best self, I'd be like in my community, like helping people, using my like mind, but also using my body. Like I want to physically feel like I'm there. Whereas I simultaneously was doing like a pharmacy rotation at CVS where I was just like not using my mind or my hands. I was just so bored, honestly, just to to save everyone. And I was also working in a hospital, like ER kind of pharmacy thing. And
Mm.
I was just like, this isn't it. I needed so many cups of coffee. And I was like, what's the point of life if you need like 5 cups of coffee to get through it, right? I don't know if you've ever felt that, or did you feel that way, like learning
Every day.
pharmacology?
Every
Yeah,
day, Connie. Every day. Right now.
yeah. You're like, okay, I'm in that. Yeah, so I was like, there's got to be more to life than this. And slowly, that in imagining how my dream self would show up, like, okay, in the community, using my hands, blah, blah, blah. I also started to show up in my real life a little differently. I started to do more like arts and crafts that summer. And I was in the middle of doing some kind of like project. And I was like, oh man, I wish there was like arts and crafts, but to help people, like help people feel better. And in the corner, I still remember of that room. I had my brother-in-law's like painting. It was like in a basement, and he is a dentist, and he does really good art. He's like a way better painter than I am, by
Um,
the way. So like, I think that's kind of funny that I thought we were similar. But I'm like, he likes art, I like art. He likes being a dentist. I think I could like being a dentist. Um, and I think it's so funny because looking back, I'm like, Connie, that is like so not how to choose a career again. Because like being a dentist is hard. Like it's not just arts and crafts people listening. But that's how I ended up choosing dentistry.
yeah, but it was great because you got to follow kind of your passion into the career. You got molded by your surroundings, the
Mm-hmm.
social side of it, and then it brought you back into. So, how do you feel now? But wait, before we get ahead of ourselves, now you're working as a dentist.
Yes.
It's been 9 months, right?
A little bit more than 6, maybe. I started July. Yeah, 6ish.
Okay, a little over 6 months.
Yeah.
How are you liking it so far in the real world, so called of dentistry?
I have to say, and I think everyone has a different path. Personally, and I think more people need to hear this story. I personally I love it, you guys. And I might just be naive, but I love it and I am really happy that personally for myself I decided to jump into the real world because everyone has a different path, like I said, right? I showing up every day with my license on the line, learning real life dentistry, that's how I learn. I love learning like sink or swim style, and I've learned that about myself. Some people want to do the residency, some people want to become the super GP, place the implants, do the sinus lifts. That's fine. But that's not really like part of my plan. That's not that vision I envision. What I love is like I love seeing like, okay, the Smith family, mom's here, dad's there, kids are all like in the other hygiene room. We have like 5 hygienists, right? So I love getting to meet the whole family. I love catching up. Like the stuff I love is the general family dentist stuff, like bread and butter. And so in some ways it's better than I ever could have dreamed. And then in other ways it's worse than I ever could have dreamed. So it just depends on the day. You caught me on a very like medium day.
All right, all right. Hopefully, more good days than bad days, right?
Yeah, I think that, there's no career that's not going to have the bad days because if it didn't, then you probably don't care about it in that sense. Like if you to care and to want to do better and be better is to know those feelings of like failure and those feelings of
Mm-hmm.
disappointment. So definitely like I feel like the highs are really high and those are what I cling to and those are better than even my best days in dental school, by far my best days in pharmacy school. Those were tough times.
That's great. No, that's fantastic, right? Yeah.
Yeah, but I do want to paint a realistic picture for anyone listening that is still studying. It's just so different. It's so much more like dentistry. For anyone that can see the screen, I don't know if this is video, but the actual dentistry with my hands is like this much of my day. Like maybe like 20-30%. The rest of it is like reading people, reading my team, reading my patients, getting a sense of like their understanding, educating people, communicating, being a therapist. Like it's just so much more all encompassing than anything I could have imagined in school, because in school you're not like managing a team, you're not the only one making the decisions. So it's definitely a lot, but I'm very grateful for that opportunity.
It's crazy how much it's different, right? I'm noticing that in
Mhm.
residency too. I thought it's like, oh, you walk in, you do the surgery and leave. No, 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 no. Surgery doing it is maybe less than 20% of the time. There's
Yeah,
test work, there's phone calls, there's dealing with insurance companies. They're running between hospitals. There's taking the emergency down in the emergency room. They're taking them up here to do the incision drainage in the clinic. Oh,
totally. I'm actually curious, what's your, like, favorite procedure to do?
I really like. So to be, I love doing the most complicated extractions.
You
I like to do them.
do?
All extractions. I like implants, sedations. Teeth titanium. You're not going to see me doing head and neck cancer, in the
Got
near
it.
future. I really like just kind of bread and butter oral surgery. I want to get out in the practice, and
Mm.
and I'm sure you could attest to this because you've been doing the podcast about 2 years now.
Mhm.
There's a much larger audience, and actually, you mentioned this on several podcasts ago. How healthcare right now is kind of broken, or like
Mhm.
not even kind of like really broken between the insurance reimbursements, but it's more insurance centered care now rather than patient centered care, and there's constantly this battle between trying to do what is absolutely best for the patient and then restrictions and finances and
Yeah.
timing and um, I'm looking into contracts now, which you did.
Oh,
A
yeah.
restrictive covenant?
Yeah.
Who invented this stuff?
No,
What?
it's like they don't it's like whoever's, like, in charge of these things, like, doesn't remember what it's like to be one of us. Like, they don't
Oh,
remember what it's like to be a clinician.
they have no idea. They have no idea.
Yeah.
And like, it's about putting shackles to our feet, hands and feet, and like, just I don't know. I don't know. So
Well, I think, like, a big thing is what we do is so specialized, right? Even to be a general dentist, 4 years of training, it's so specialized, and so we have to put all of our energy into training how to do the thing, right? Because of
yes,
that, we're not equipping ourselves with, like, the skills to communicate, the skills to advocate for ourselves, to, like, the higher, beings. So because of that, we're becoming more and more like specialized sheep, I feel like, and we
vulnerable,
need
very
some.
vulnerable.
Yeah,
Hmm.
we're vulnerable, right? We're just listening to the shepherds. It's like the insurance, like the systems. And I feel like we need, like, now is the time that's like ripe for disruption. That's why I'm so passionate about this because, like, if we don't get our act together, like, we're already, like, the public is losing trust in us. Trust in providers is at an all time low. People now with the internet and like information and stuff, like, we're facing a new battle and it's not just cavities and stuff like it used to be in the golden days of dentistry now. And so we have a new war that we're facing, and
Oh, a
I
big
want
one.
people to set up.
Oh, and what about the debt, college debt,
Yeah,
dental school
exactly.
debt? Like, we're really hitting the
Yep.
crossroads here. So that's why, I mean, that's a big passion behind why I like to connect and network over social media too. I really think
Mhm.
that I see you doing that as well. There's a bigger battle here,
Yeah.
right? Like, so that's why rather than really getting deep into oral surgery and head and neck cancer and the orthodontic surgery, it's fantastic, right? There's a
Mhm.
very big battle that we need to face as clinicians and band together because we have so much vulnerability and
Yeah.
everyone above us is using that as leverage over us and it's sad. We're the ones that take the oath,
Exactly.
not the
I
private equity funds, right?
Right.
Not the
Right.
so
You know what I see in you that I kind of see in myself is, like, we love what we do, right? I love dentistry. I love what dentistry can do for people, but I know that we could be doing more. Like, I want more people to realize how awesome dentistry is, and because of that, I feel like you and I feel like we have to, like, kind of change the industry. So, like, we're doing the training, we're serving our time like doing that, but we're also in our free time, like, we're banding together the people, we're having these conversations like in our free time. It's like 8 o'clock on like a Tuesday night, like, we're going above and beyond to, like, in history class, okay, this might be a little extreme because, well, also I'm not good with history, but in history when you would learn about like the underground group of rebels that would like band together and be like, all right, at dawn we ride and we do this. I feel like that's a extreme version of like what we're doing. We're having those midnight conversations, making those plans to like take on that new war, and I think that's kind of cool of us.
I think so too. And you know what? You said it's going above and beyond. And then
Yeah,
what's weird is because in those circles we talked about, there's certain people that are like they're putting up resistance to that. They're like
totally.
shunning it. I'll tell you what,
Hmm.
especially in the medical side of healthcare and in oral surgery in general, there's
I'm
so
sure.
much shunning of social media. And it's like, look, guys, literally, this is the answer. You're
Yeah.
fighting with insurance companies on the phone. We need to band together and figure that, like,
That's exactly, it's so creepy that you, like, mentioned this because, like, the universe. Like, on my drive to work this morning, I had this kind of, like, argument with myself in my head involving, like, a fake, like, critic of what I do. Because sometimes when I post things, like, I'm a human being, right? So I do care about, like, how things are perceived. I don't want to come across a certain way, but at the same time, in order for me to like change the field and whatnot, I feel like I have to speak up. So I had this conversation in my head earlier about like this tension that we feel with like the status quo. You have like the old school people being like, this is how we've always done it. You can't descend into anarchy right now because we're hanging by a thread. And my side of it was, I was like, no, like this is the time to disrupt. Like it's now or never. And
Right. And the
it's
traditional
wild.
mentality is what got us in all these issues too.
Exactly. And like not for nothing, I feel like, they ended up a certain way because they inherited problems too, but it's like the quote like hurt people hurt people. Like
Hmm.
there's a reason why we're here, and unless we kind of like stand up to it and like change things and change, like band together like what we were saying, we're just going to keep perpetuating the same old thing.
Oh yeah. Oh yeah. Actually, and yes, one by networking and connections like this is one way.
Yeah.
I also have there's some behind the scenes stuff that we can definitely do to change this, just from as small as mentoring to Prudence to growing,
Yeah.
fighting back against insurance companies. But wait, really quick.
Yeah.
This is a great transition. So we're talking about social media,
Yeah.
podcasting, connecting, networking. What got you? So pharmacy to dental school. Now you're working as a dentist, but you started the podcast before you graduated.
I did, and it's kind of funny because like everything in life, I started it thinking it'd be one thing, and it's turned out to be like something totally opposite. So, how I started it was like third year. Ugh, clinic was a grind. I don't know if you felt this way. Third year was the hardest year of dental school for me. I don't know. What was your
Totally agree.
hardest year?
Totally agree.
Really? Yeah.
Mm-hmm.
Okay, so like third year was a
Easy
grind. I
for
was
us.
showing up to clinic, and it was weird because I was like, I'm like 20 something years old. I feel like I don't have my life together. I don't know how to like change my oil in my car. I don't know like how to do so many things. But I'm showing up to clinic and I'm expected to like be in charge of people and like tell them sad news and like be like have responsibilities. And that juxtaposition, I was like, this is so weird to be like this young girl battling these feelings of like telling someone like, oh, I don't this doesn't look, I never diagnosed someone with cancer, but being like, oh wow, this like looks like cancer, and then like having, and then going home and calling my dad and being like, I don't know what's wrong with my car, right? So I was like, so, that's just like kind of a weird thing for one girl to be having all these emotions. At the same time, I would listen to podcasts. Like the one thing that saved me in school was listening to these like girly self-help podcasts, like the girls in their green juice that wake up and have a 3-hour routine. And I would listen to it and I'd be like, man, like I want that life, but like that's not gonna, like that's not how I live. Girlies in healthcare, like we have busy morning routines that are like maybe an hour, 30 minutes if we're lucky. So I was like, there needs to be something like this out there for us, the girls that like the self-help, like all of the self-care and lifestyle content. But there needs to be something like realistic for us women in medicine or healthcare. And I feel like a lot of the podcasts at the time were just like talking about clinical stuff. And like, I don't know about you, but I'm like,
Mhm.
I don't care about that stuff. I want to talk about like what you brought for lunch. Like, what are some ways to spice up scrubs for an outfit? Like, that's what I want to
Yeah,
talk about. Yeah, you get it.
we do. We do. And the morning routines and everything.
Exactly.
I'm completely bought in. Yes.
Yeah, so like that's kind of how I started it. I started it being like, okay, this is a podcast to teach young girls who take care of other people for a living how to take care of ourselves. And I was like, okay, cool, there's that. I love the self-help aspect of it. That's always going to be a common thread in what we talk about. But as I've gotten, gotten more I don't know, older, as I've gotten more experienced, I finished third year, fourth year, now I'm treating my own patients. I realize we have a much more insidious problem at hand, which is that like patients aren't listening to us when we're talking anymore across all fronts. Pharmacy, I have listeners of my podcast that are like pharmacy, nursing, dental, medicine, all across. Like I said earlier, trust is at an
I
all-time
totally
low. And so
agree.
that's when I started thinking like, okay, what can I do to help this problem? And I am but a little girl who likes to have silly conversations, right? That is my role in life, and I've acknowledged that. And so how I show up in my role is I realize the power of small talk. I realize like when I can make good small talk about like Taylor Swift, the Super Bowl, the random celebrities with my patients, that's when they start to trust me. Not when I show them like, hey, here's a statistic and here's on the x-ray where the gray, they don't give a crap about that. Like
We don't know
they give
about
a
it.
crap about my thoughts on Taylor Swift. Like that's what they want to know. And somewhere along the line, this is part of what I was thinking about this morning on my drive to work. Somewhere along the line, being a normal person with your outside of work interests started to like, people think that's unprofessional, and like I'm here to kind of show like there's nothing unprofessional about it. I can be a Taylor Swift fan and do like the best filling ever, like me liking Pink, liking Taylor Swift, liking to talk about silly pop culture things. That says nothing about my quality of work.
100%. 100%. It's human. It shows you're human too. That's how you connect with patients. I love that. I'm on
Exactly.
board. I'm on board. Yeah.
And so that's how my podcast kind of pivoted in recent months. Now we share 3 small talk pop culture stories for you to share with your patients. One, it's like a little bit of like levity, some light for whoever's listening on their way to work to be like, let's forget that I'm like a nurse for a second and let's talk about this pop culture. So it's for you as the listener to take your mind off of things because we don't have to be clinical 24/7. But then it's also for you to take to work and be like, hey, I heard on this podcast this funny story about like Usher. Like, did you know this? And it opens up conversations. So that's my newest frontier, and that's kind of how I got here.
And then that's fantastic. And then you have the chief complaints on Fridays. And I
Yes.
also like how you kind of like say you're delivering content, right? It's in like a present, and you wrap it up very nicely. So it's kind of like catered to women, but
Yes.
I listen, right?
I'm so glad
And
you do.
the
We have some male
content,
pinchers.
and that's what I'm saying. The content doesn't necessarily, it's both ways. It's pretty
Mm-hmm.
even. Like I need help on how to stop worrying about distractions. And you were talking about literally on the one scrolling through Instagram after an hour. It's very unproductive. I'm with you there. Right. And it's like,
Mm-hmm.
I scroll through Instagram too, so it's like, you're not just speaking to women, although you were leading them in the right direction. I love it.
Aw.
I'm a big fanboy for your
Thank you.
podcast.
Oh my gosh, you're a pincher, as we say. Thank you. We welcome you as our male pinchers.
Awesome. Awesome stuff. Yeah, yeah. So I wanted to hear about the chief complaints on Fridays. You do them every once in a while with Jimmy, right? Or all the time with Jimmy?
Yeah. So okay, it's kind of funny. That was like a byproduct. So I started out as like editing Connie butts in. When I'm like editing, I'll add commentary, be like editing Connie here. I said this earlier, but I actually think this, right? Slowly that became editing Jimmy in the background, like of me saying, because I used to play it out loud before I had like headphones. So he would listen and give his commentary. And listeners started to be like, oh, we love Jimmy chiming in. So that evolved to him helping me some Fridays with chief complaints listeners submit, like I have a fight with my coworker, my boyfriend, blah blah blah. Like it's like real life stuff. And Jimmy helps me answer stuff. But now recently, we have extra guests on. So like Brendan's gonna be a guest on. He's gonna help us answer. And it's just a fun way to kind of it's like our own little advice segment on Fridays.
I love it. Fun
Mm-hmm.
Friday, get into the chief complaints.
Exactly.
And you have so many different angles to your podcast where it's like it's constantly something new, something fresh for your ears. I
Oh,
think
thank
that's
you.
excellent too. And now that you brought in Jim, so Jimmy's your husband, right?
Yeah, he's my fiance. I am working on planning the wedding as we speak. But yeah, he is kind of like a staple character. We have him on. It's usually him, or every now and then we have a guest if there's like a realm that I think that they could help us answer, like Brendan. We have a question coming up for him. Or I also have Masha, who is my nervous system coach. So have you heard of this, Brendan? It's like nervous system coaching. Have you heard of this?
No, no, no. I saw that she's on your podcast, but yeah, please tell me more.
So like when I first heard about it, I was like, oh, is this like a woo woo thing? But like, it's actually like science based. It's real coaching. I did her 6-month coaching program. And so basically the reason why I have a nervous system coach on is because us people in healthcare, our nervous systems are whack. We're constantly hearing like the beeps, the screaming, the blood, we almost like it, right? Because like, that's what excites us. That's what gets us out of bed. But the problem is we can't always be like that. Like we plateau at a certain point when our lives are just constant dysfunction, stress, blah blah blah, and we don't even realize how many of our like childhood experiences have shaped us into like in our nervous systems into how we interpret things.
Mm.
Your nervous system shows up in everything. How you talk with your patient. If you notice like you say something, the patient's getting defensive, you get defensive. It's like this escalating battle. It's all happened to us before. There was something involving each of your nervous systems in that. And so having a coach on helps us unpack like what happened there? Why did they escalate their voice? How can I kind of handle that better? Because as providers, like yes, we have our craft, but I feel like we're actually master like emotional we're like crafting emotional experiences too.
Oh, absolutely. 100%. Actually, that's a really good point with the nervous systems. Since about my fourth year of dental school, I have to take, I switch. I try and wean off of it.
Mm-hmm.
Omeprazole. I
Oh,
get this
really?
stomach acid, like especially later in the
Oh.
nights when
Yeah,
I'm on
yeah.
like the 24-hour shifts and it's hitting right around midnight, right around the
Mhm.
18 to 20 hour mark. I
Yeah.
get the worst stomach acid, and
Damn.
the only thing that helps 100% is omeprazole, and then I switch back. I try to wean off it, go to Pepcid, and then come off.
Yeah.
I just can't get off it, and
It's probably,
it's
like, all
nervous
that
system.
stress. Yeah. Your nervous
It's nervous
system and your
system
gut.
center, 100%, 100%. Yeah.
That's wild.
So I think I'm going to need a nervous system coach in the future because I don't really like coughing up acid when I'm talking to patients in the middle of the night anymore.
I am telling you, one, yeah, we gotta fix that for you. And then two, you need to meet Masha. She treats, so I know that like you're doing like the surgery route, but she treats like dentists all the time. Like her whole clientele, she's kind of specializing in dentists because we have so much like unique trauma. I'm telling you, you gotta at least follow her on Instagram. She's at Masha K. I'll send you the link after, but she's 100% worth a follow.
Thank you. Yeah. Yeah.
Yeah.
100%. I want to take a look at that.
Mm-hmm.
Wow. Wow. Oh, there's another thing I wanted to touch base on. Oh no. There was another topic I wanted to get. It's slipping my mind now.
Did you message me earlier about this?
I didn't. I didn't. I
Oh,
usually
okay.
just think about these things throughout the week, the
I
day,
love it.
and
I'm the same
crunch it
way.
in.
Is
And
it
you saw my
career?
face all red. What was that?
Is it career related?
Is what career related?
The question that you were thinking of. Career, life.
It had to do with, it was somewhere in between. Oh, here we go. Got it. We're back. Your podcast is self-help, and you said through dental school, some of the ways you escaped and it really helped center you through the time of dental school is listening to your own self-help podcasts and such. When do you get your podcasting, like you're listening for your ears,
Mm-hmm.
right? Because you're obviously and I know this, it takes a lot of time. You got to plan out podcasts, you do it yourself. But then what about taking in information and kind of taking time to, when do you find time to listen to podcasts yourself? Read books, maybe that has to do with watch YouTube videos. What's kind of your
Yeah.
thing?
So my main thing is podcasts simply because my commute is really long. That's kind
How
of like
long?
what I signed up for. It's like 40 minutes to like an hour sometimes. Yeah, and I'm like now I'm 4 days a week, but I'm covering for a dentist on maternity leave for a couple months. So for the next like couple months, I'm 5 days a week. So that's basically I kind of like it though because I like bookend my days with podcasts.
I love that. Wait. 4 days a week, now five. You're getting paid for that extra day of the week, right?
Oh, I simply must be. Yes, I'm getting paid for it.
Oh my God. I was gonna say, because that
Yeah.
salary kind of job thing
Oh
is
yeah.
such a,
Actually, that is a great thing to touch on. That is like probably the hardest thing for like for any pre-dents out there listening, thinking you're gonna ride off into the sunset being a dentist. You're not. It's like being a dentist in most cases, you're almost like commission based. It's kind of like what you work for is what you earn. And so that's a tricky thing. People think like, oh, dentists, they like play golf and they buy cars. It's not like that.
not at
That
all.
used
Not
to
at
be
all.
like that, but it's not like that anymore.
Right. You can't just see 7, 8, 10 patients a day and just be ready to buy a Ferrari. It doesn't work like that. And
Yeah.
that's a good point. Commission based is one thing. So you want to make sure you're getting a higher percentage on the commission. And you
Hmm.
do not want to fall into that salary trap of whatever job employer wants you to earn that, because they'll sign you on for 3 or 4 days a week. Oh, you're
Hmm.
going to make X this year. No commissions based. Like, oh, great, good. I got a salary. I got a stable job. And
Hmm.
now 3 days turns to 4. And then 4 days turns to 5. And then they're calling you on that Saturday, like, hey, Stephanie
Exactly.
called out. And can you come in the 6th day in the week? I know you're only on 3 to 4, but we don't have anyone else. Can you do it? We have a half a day today. Can you see them? And now you're working and producing twice as much as what you're getting paid for, maybe even more. You
Hmm.
don't want to let your employer get hauled down like that, because then I don't know. You got to get what you're worth, and then some students have
Totally.
loans to pay back. I could go on. I know. But
It's horrible, but that's why we're in this trap. Like, talk about why. Like, I mean, I touched upon how like we have a communication problem with patients, right? They don't listen to us anymore. There's something going on there. Part of it is because we're all like so stressed, just trying to pay back our loans and like make the money for the thing that we thought we were getting into. Like, of course we're not acting like. Of course, we're acting stressed, and it's making us not show up as our best selves. Like the system is so broken from the debt to the payment to there's so many angles, the insurance, like there's so many almost parts that are messed up that it's kind of like, where do you start first?
oh yeah, oh my God. And to add, I'm sorry to remind you, but you're planning the wedding on top of that, no?
Yes, yes. Oh my gosh, yeah, that's the wildest part is like I feel like such a kid and then the other day I was pumping my gas and I just like was randomly thinking about stuff. I'm like, "Whoa, I'm a dentist. Whoa, I'm like getting married and like wanting to buy a house." I'm like, "When did this happen?" Because I still feel like that 18-year-old that I was talking about earlier.
Was it a kind like your intuition, your gut feeling? It was
It was
good.
weird. Yeah, oh yeah,
It,
no, it was like awe. It was like my 18-year-old being like, "Whoa, we really did that." Like these are the days that I dreamed of and it still feels like a dream sometimes on the good ones.
excellent, excellent. That's always good. No, because you got to stop and smell the roses. My
Mhm.
mom always tells me that you got to stop and smell the
Are you
roses
good
once
at
in a
that,
while.
or are you someone that, like, struggles to remember that?
Horrible. I don't look. I
Same.
run right by those roses. You know.
I'm like, "Roses?" I'm like, "I got a new mountain to climb now."
There's always another mountain in the distance,
I'm
right?
like, "There's you should see the roses on that mountain." Like, I'm trying to smell those. Yeah, I'm the same way.
They're a lot higher and it's a lot steeper, but we're gonna get there.
Yeah, no, but we're just, like, insane, so yeah.
It's always that could be a very tough spiral. That's a really good point. But no, I'm glad that you had that. If it's a moment of probably a moment where you got to
It's a
stop and kind of
moment.
recognize your accomplishments and achievements that you come so far. You made a career change
Mhm.
and you're succeeding in it. No, that's huge.
Thank
That's
you.
huge.
It doesn't
But
always feel like succeeding in it, but but when you say it like that, thank you. It means a lot.
and I really think, in addition to your personality, your experience is really what kind of gets you to connect and bring out all your experience and emotion and feeling into the podcast.
Mm.
I really like that. I really like that about that. I want you to keep doing it.
Thank you. That means the world. Thank you.
Yeah, yeah. So we're kind of wrapping up here again for the part one, right? Did you want to? Was that on Friday that you said with Jimmy the chief complaints, the questions, or would that be another day? How would that work?
Yeah, we could do it a couple ways. I it doesn't matter. We could hop onto like my Riverside. I could always record. It like sometimes I have guests on, so you would be like a guest Friday special episode. So we could always record on my own Riverside. That way I'd have it. Doesn't matter to me.
Sure, and we could do it tonight. I'm available tonight too. What's best for you?
Yeah, let's just keep recording then.
Yeah, sure,
Or like if
perfect,
you want, you can like end this and then we'll start. I'll send you the link on Instagram for my Riverside.
perfect. Let's
Okay,
do
cool.
that so that you can get that.
Okay, awesome.
Good stuff. All right, let's do it.
Okay.